patient needs help, there is no nursing staff. Now what will happen? It is well understood among Central Kansans that there is an aging workforce. How will this affect you and your community? No one is there to deliver the necessary medical help.
My mother had passed away. She'd been in a car accident my freshman year in high school, and as far as what we've been through in the hospital, you know, with me being so young, especially in high school, I experienced a lot of nurses who were really compassionate as far as, you know, they took care of us as a family and took care of my mom, and it really showed me a lot about these people that took care of her, and I felt like that was something I wanted to do.
There are 76 million baby boomers ready to retire. It is a major challenge to meet the health care needs of these individuals. In this age group are also many healthcare professionals that will no longer be part of the workforce, and they themselves will need more intensive health care. At the same time, our nation has a nursing shortage. To meet the demand for nurses from 2010 to 2019, nursing education programs must maintain admission numbers that are being established at the present time, but they need to increase. Otherwise, enrollments may be insufficient to meet the need of the increased aging population. In Kansas, it appears that new graduate supply has not met nursing workforce demand, as hospitals are currently experiencing a 4.9% vacancy rate for registered nurses and an 8.5% vacancy rate for practical nurses. These vacancy rates reflect an estimated unmet need in acute care for 740 RNs and 645 LPNs. These numbers do not include current shortages in the other 40% of nurse employers, such as long-term care and public health. Barton County in Central Kansas has always realized the importance of good health care for its citizens. Can we continue to supply our medical facilities with qualified nurses? With the high demand, we need more qualified nurses, which creates a market-driven competitiveness in compensation and skills in the nursing profession. Those individuals who choose education as a career are now being enticed to leave their passion for market-driven salaries and other healthcare professions.
I came and took this job basically from my other income. I took like a $30,000 cut per year. Very substantial. And the thing is that the generations that are coming are not going to accept that. They are going to say, wait a minute, I have now been prepared academically, I have my master's, and some may even have their doctorates, and then when it comes to teaching, they will not accept those types of salaries. So somehow, for the educational, for the nursing instructors, we have got to get their salaries up.
That's where the money is. We're always going to have health care, and nursing is a good profession where I could go anywhere in the country and get a job.
All right, good job.
Working as a nursing professional in other areas than education enables them a higher standard of living. The consequences? Nursing instructors are not going to be available to provide the industry with a qualified nursing staff. No nursing program administrators, no education, no new nurses, no service to the community. Historically, the nursing demand has always been a priority for this community. Nursing education began in Barton County when the St. Rose Hospital School of Nursing opened in 1917. The St. Rose Hospital School of Nursing in Great Bend and the St. Catherine School of Nursing in Garden City were combined in 1953 to form the Dominican School of Nursing. In 1966, a partnership between Barton County Community Junior College and the Dominican School of Nursing initiated the Associate Degree Nursing Program as one of the curricula to be offered at the new college. In October of 1968, Sister Mary Ann Klein O.P. was appointed the first Director of Nursing Education at the Barton campus.
It was challenging, but the students came because they wanted to become nurses, and then they get in their pin and their diploma was a big thrill for them and for me. What do I want to say about the future? One thing I told the students, I said, you're going to be better nurses than I am. Oh, can't be. I said, you will be, because the technology that's coming in, and like I said, we only had slideshows to show it to, well, now they have videos, they have films, they have computers. Education doesn't stop there though.
As of May 2005, Barton County Community College graduated 1,434 associate degree nurses, and over 800 practical nursing certificates were awarded. What decisions are we making now that will ensure that the number of quality nurses is adequate? Our nursing programs have to educate a sufficient number of nurses to both meet future demand to replace retiring nurses, as well as to promote growth of the nursing profession.
Your average working nurse is 46 years old. So we've got to keep our enrollment up and be able to educate and, graduate nurses so that we can keep adding to the working force so that we can have nurses available.
Nursing is a rewarding career.
I want to take care of people.
I know a lot of nurses, and they seem to be the people I admired the most. Plus, I've done some other college degrees, and I just wasn't finding satisfaction with people relations. So nursing is one of the things that you get one-on-one time.
I decided to go into nursing and because there's just such a need for nursing, and I just love to give patient care.
The need for nurses at the time, Barton County is special to me because I've gotten everything medical through this college. And so it's like, okay, it's time for a jump to LPN because they're needing nurses. It's something I can do and I'm good at it.
The relationship that we have with Barton County Community College is very important to our hospital and very important to our community.
Would you like to speak to Sister Elizabeth or pastoral care or anything? Or do you have your own minister that you'd like to call?
Own minister.
Okay, I'll get that phone number from you and then we can call him, and usually they come up and visit you pretty quick, okay? Okay.
We really appreciate our relationship with the college. Prior to my coming here as the chief nurse, we used a lot of travel nurses and agency nurses, which were a very high cost to the community to provide nursing care. Through developing a relationship with Barton County Community College, we now have local people taking care of local people.
I'm from around Great Britain. My family's here. CKMC is all I know, and I like it here, and it's a great job, and that's why I wanted to stay here. And it was very nice that there was a college right here for me to be able to go to and plus then work.
It's a good feeling to know that you can do something to help somebody who's in a need, and nursing provides care for patients, and to be able to fulfill people's needs is very rewarding for me.
I'm Christy Tustin, Executive Director for the Golden Belt Community Foundation.
Hello, I'm Darnell Holloperic, Executive Director of Institutional Advancement at Barton County Community College.
I'm Mark Menschenbach, Vice President of Professional Development at Central Kansas Medical Center. We hope you've enjoyed
the Sister Mary Ann Klein Nursing Endowment video. The
partnership between the Barton County Community College,
Central Kansas Medical Center, and the
Golden Belt Community Foundation shows our
commitment and long-term investment for the
future of healthcare in Central Kansas. We ask you to contribute
to our mission and our collaborative effort.
The bottom line is
neighbors helping neighbors be healthy.